This is the Arthrokinematic Restoration System for the thumb, or the CMC joint. So this is a site where there can be pain and arthritis, and it is a multi-directional joint, and we use this quite a bit. And I'm going to first review the arthrokinematics. It's going to roll and glide differently depending on the plane you're in. So when I extend the thumb, I'm going to have a concave metacarpal moving on a convex trapezium. So it's going to roll and glide in the same direction, concave on convex. If I abduct the thumb and adduct it, so I'm abducting the thumb, I've got a convex metacarpal moving on a concave trapezium. So it's going to roll and glide in opposite directions. We're going to look at the thumb extension. So if I extend the thumb, I am going to roll and glide inferiorly. So we're going to work on restoring that glide. To do that, we want to release and stretch the muscle that is going to prevent that. And then we're going to strengthen in the direction to encourage the glide. So I'm going to find my thenar eminence. And just above that larger portion, I'm going to go into the middle area, and there's going to be a little muscle that's going to be the flexor pollicis brevis, and that's going to be the muscle that I want to focus on releasing. So it's going to be the thenar eminence. So that thenar eminence can sometimes be tender, but want to work on the flexor pollicis brevis and releasing the tension on that muscle and the fascia and working into that area. And I'm just going to apply pressure and mobilize, and I want to go perpendicular to the muscle. So it's going to come this way. So once I find my muscle, I want to then apply pressure perpendicularly and slowly working on those fibers. Once I have released there, I'm then going to take the thumb and bring it into extension to hold that stretch. And as I'm stretching, I'm going to tendon glide. So I will bring my fingers, keep them together, slowly bend at each joint, then extend that lumbrical puppet and bringing it back up. So this is going to be mobilizing the fascia. And as you're doing this, if there has been restriction in that thumb, you'll feel some change because of the tensegrity model, the connection in that web-like fascia. So mobilizing here for a minute. When I finish the stretch, so we've done the release, the stretch, then I'm going to strengthen the extensor pollicis brevis. And to do that, I'm going to use a resistance band, and I'm going to place it just above the joint. So I'm going to place it above the CMC joint, and then I'm going to apply resistance to extend, pushing out, hold it out for 10 counts, and then relax. So I'm going to repeat that 6 times, working on strengthening the extensor pollicis brevis. And I can do multiple sets. If I start to have pain, I want to stop. So I'm just building up that strength and that muscle so that I can have some support over that CMC joint. And that completes the arthrokinematic restoration system for the thumb.